Hi, my name is Carey Rothschild. I'm a physical therapist and clinical associate professor at the University of Central Florida's Doctor of Physical Therapy program. I'm here today to talk to you about the importance of your pelvic floor as you age. Did you know that 1 in 3 women and 1 in 10 men experience pelvic floor dysfunction in their lifetime? Many individuals believe that pelvic floor conditions are a normal part of aging. While they are common, they are not normal, and they are very treatable. So you may be wondering, what is the pelvic floor? Today I've brought a model here to show you the different components of the pelvic floor, which consist of muscles that are here shown in red, the different ligaments that are shown here in blue, as well as connective fascia that kind of support the entire pelvic girdle. One of the roles of the pelvic floor is to support the pelvic organs. This is a female pelvis, and you'll see inside that all of these red muscles help to support the bladder, the uterus, along with the rectum. In the male pelvis, the pelvic floor will support the prostate. The function of the pelvic floor is to provide stability and function of the pelvic girdle, to help maintain continence, to help allow for urination and defecation, and is involved in sexuality. With age, tissues lose strength and elasticity and may not provide adequate support for those pelvic organs, which may lead to pelvic floor dysfunction. Sometimes these tissues become too tight and they are not able to function properly to support the pelvic organs, which may lead to pelvic pain. Childbirth, surgery, and menopause can also affect the weakening of the pelvic floor muscles. Common pelvic floor dysfunctions include urinary incontinence, fecal incontinence, pelvic organ prolapse, and pelvic pain syndrome. You may be wondering, what are some signs and symptoms of pelvic floor dysfunction? Well, these include leaking urine when you cough, laugh, sneeze, or exercise, a sudden or strong urge to urinate, leaking stool, having sexual dysfunction, or having persistent discomfort or pain in the lower abdomen or pelvic region. There are many negative effects of having pelvic floor dysfunction as you age. Pelvic floor dysfunction can lead to decreased quality of life, can also lead to physical and mental health conditions. There is also associated embarrassment and disablement, which might lead to social isolation, which we know socialization is very important as you age. There's also decreased function in the performance of physical tasks, and pelvic floor dysfunction can lead to the loss of personal and social relationships. Furthermore, there may be a decrease in the ability to participate in leisure activities. So you may be wondering, what should I do about suspected pelvic floor dysfunction? Well, the good news is that treatment is available. There is no need to continuing to wear undergarments or avoid activities and outings that you enjoy. Kegel exercises are not always the right treatment method. The treatment should focus on strengthening and re-educating the muscles of the pelvic floor and the pelvic girdle. Pelvic floor physical therapists are especially trained to assess these muscles and develop personalized rehabilitation programs to address specific concerns. So you may be wondering how pelvic floor physical therapy can help you. It can really help the aging process of the pelvic floor by managing incontinence and preventing falls. In fact, falls are often caused by incontinence. Pelvic floor physical therapy can also help alleviate pain and discomfort, help provide support for mobility and balance, and further empower independence to reduce the dependency on caregivers. So you may be wondering, why should you choose pelvic floor physical therapy? Well, it's a drug-free solution to many common challenges faced by aging individuals. Pelvic floor physical therapy focuses on the body's own ability to improve strength through targeted exercises and techniques, and it's customized to your individual needs. Pelvic floor physical therapy is often covered by insurance, making it pretty accessible for many seniors. With the right professional guidance, you can learn about techniques that can practice at home and lead to long-term improvements and independence. You can find more information about finding a pelvic floor physical therapist by scanning the QR code below.